Well, there are calls this morning for Ontario's Minister of Long-Term Care to resign and calls for a public inquiry after a military report revealed what's being called, quote, horrific and deeply disturbing conditions in some of the province's long-term care homes. For reaction and what needs to happen right now, I'm joined by Dr. Samir Sinha. He is the Director of Geriatrics at Mount Sinai and the University Health Network Hospitals in the city of Toronto. Dr. Sinha, this report outlines shocking details to the public. These were not shocking to people who work in your field. You've been making these calls for a long time that something needs to be done in our long-term care homes. To remind people of some of the findings from the military, it points out residents were left in soil bedding for hours or days, residents crying out for help, sometimes up to 2 hours. There were sightings of cockroaches, ants, and flies. You have been a long-term advocate for older adults. To your knowledge, how long have conditions like this been happening?
Anne-Marie, what's disturbing is that if you go back in the newspapers, for 20 years or so on, we've had repeated concerns like this that have been raised and many calls for action and many promises from former ministers of health to fix these issues once and for all. I think some of us took comfort in terms of saying to ourselves, maybe this was a once in a moon event or a limited activity. But I think what the military saw in only 5 of our homes were real systemic problems due to understaffing and just poor quality standards that aren't just related to COVID, but go deeper than that.
Yeah, it took a military report, it took the military coming in to highlight these problems, to really motivate this kind of outrage, to motivate some change. In just the province of Ontario, more than 1,500 long-term care residents have died of COVID-19. Also, 6 healthcare workers have died. What have we learned about how these homes were dealing with COVID-19? These were extraordinary circumstances.
Yes, and I think what the military pointed out was that even when they were really just going into 5 homes that were particularly ravaged to provide, an extra pair of hands, we were seeing staff, for example, who were fearful of using the PPE because of the cost, or staff that just didn't know how to use that personal protective equipment that then put these military officers at risk as well, but also the residents that they were meant to care for. And so it really just showed how this wasn't just something that was happening during the pandemic, but there were deep-seated issues here that were happening that really allowed this to spread further, and probably why some of these outbreaks were as bad as they were in these homes.
The Ontario NDP are calling for a full public inquiry. Premier Doug Ford has promised justice for the residents and their families. In your opinion, what needs to happen right now to make sure that this doesn't happen elsewhere and doesn't happen again after the urgency of COVID-19 and the outrage around the report fades?
Well, I think the report showed that in these particular homes, there were some deep-seated issues like staff not having, the training or staff feeling fearful. These are immediate actions that we can and we should be taking. We should also be making sure that these were just 5 of over 600 homes in Ontario that are struggling right now. And the question is, how, are these issues occurring in other homes too that we need to get a hold of right now and get on top of? And we haven't even seen the report in Quebec where the military are currently involved in over 25 homes and hundreds of homes that have been in outbreak over there.
We're going to speak to an advocate from Quebec in just a moment, but Dr. Sinha, just before you go, what is the fix here?
The fix is we have to keep our eyes open now. We've just, honestly, we're all to blame here. We did not hold our governments accountable when previous reports came up. We all own this, and now we all deserve it to fix it, because as we age, we're going to need care like this. And frankly, none of us deserve to receive care like this at all.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.